Introduction to Accident-Based Disorders. Hello everyone, I'm Kim. Today we're going to talk about arterial blood gas analysis and how to use it when solving accident-based disorders. So after this lecture, you'll be able to explain arterial blood gas test, which is simply called AGB test. Also, you'll be able to distinguish between metabolic alkalosis and respiratory alkalosis. Also, you can compare between metabolic acidosis and respiratory acidosis. Finally, we're gonna solve some accident-based disorders case studies using AGB test. So, what is AGB test? Basically, it is an arterial blood gas test. The main purpose of AGB test is to measure oxygen level and carbon dioxide level and pH level in the bloodstream. Commonly, the arterial blood is taken from patient waste. In order to master the AGB test, it is important to memorize the normal laboratory ranges. There are three components you should memorize today: pH, PCO2, HCO3, which is bicarbonate. Do you think is it too much to memorize? Oh, you can definitely memorize them today. The normal pH range in the bloodstream is 7.35 to 7.45. The normal range of PCO2 is 35 to 45 millimeter of mercury. Can you see that these are pretty much the same numbers? 35, 45, 35, 45. And the normal range of HCO3 is 20 to 26 milliequivalent per liter. Do you think you've got some idea about AGB tests? Then, let's warming up! Pre-test questions. Number 1. For blood gas analysis, blood sample must be collected from a syringe that contains one of the following chemicals. What do you think the answer? The answer is D, heparin. It is because heparin solution help prevent clotting. Question number 2. Which of the following requirements must be satisfied in the clinical laboratory during blood collection for arterial blood gas analysis? The answer will be on ice, no air bubbles, and no clots. Arterial blood gas is prone to clotting, so it is required to be put on an ice pack as soon as it is drawn. Question number 3. The normal range of arterial blood pH is 7.35 to 7.45. Is it true or false? It is true. Yay, you got this! The normal range of pH is 7.35 to 7.45. So, if your pH level is above around 7.4, then this is considered alkalosis. On the other hand, if the pH level is below around 7.4, then this is considered as acidosis. Remember, alkalosis is kicking the pH up. Acidosis is sliding the pH down. Here is the AGB interpretation flowchart. It seems very complicated, but you already 50% complete. It is because you already got pH part. If pH is low, acidosis. If pH is high, alkalosis. After you consider pH, depends on either PaCO2 or HCO3, you can determine acid and base disorders. In the acid and base disorders, there are two main parts: primary process and compensation. We're gonna focus on only primary process, which is non-compensation today. There are four types of primary process: respiratory acidosis, metabolic acidosis, respiratory alkalosis, and metabolic alkalosis. Here is primary AGB interpretation chart. If two components have abnormal values, it is primary, which is non-uncompensated. Two abnormal value can be in either pH and PCO2 components, or pH and HCO3 components. To determine if it is respiratory or metabolic, remember Rome. Have you ever visited Rome? Respiratory is the opposite direction. Can you see this inverse relationship? If a pH increase, PCO2 is decreased. If a pH is decreased, PCO2 is increased. On the other hand, metabolic is going to the equal direction. If a pH is go up, HCO3 is go up. If pH is go down, HCO3 is go down. In the respiratory, primary effect is PCO2. On the other hand, in the metabolic, primary effect is bicarbonate, which is HCO3. Now, you can distinguish between metabolic alkalosis and respiratory alkalosis. Obviously, both are alkalosis. Therefore, both pH level is above the normal range. But in the metabolic alkalosis, pH and HCO3 are going in same direction in kidney. But in respiratory alkalosis, pH and PCO2 are going in the opposite direction. In the lung, pH is increased, but PCO2 is decreased. Also, the main cause of metabolic alkalosis is severe vomiting and excess GI suctioning, while the main cause of respiratory alkalosis is hyperventilation. In the metabolic acidosis and respiratory acidosis, both pH are below the normal range. In the metabolic acidosis, pH and HCO3 are in the equal direction in the kidney. On the other hand, in respiratory acidosis, pH and PCO2 are in opposite direction in lung. The cause of metabolic acidosis is renal failure, but in respiratory acidosis, the patient cannot breathe well and possibly to have pneumonia. Now, you're ready to diagnose the primary acid and base disorders using AGB test. Please remember three. We have 3 steps to diagnosis of primary acid and base disorders. First, check the pH level. if it is within normal range or out of the normal range. In the second step, check the PCO2 level. If pH and PCO2 are going to the opposite direction, then it is respiratory. In the third step, check the HCO3 if it is in the normal range or if it is below or above the normal range. If pH and HCO3 are going to the equal direction, then it is metabolic. Let's start case number 1. I want you to go ahead and pause the video and before I release the answer so you could quiz yourselves. This patient has hyperventilation. The first step, look at the pH. Is it higher than normal? So it is alkalosis. The next step is look at the PCO2 and HCO3 and determine if those are within the normal range or out of the normal range. In this case, we see that the one that is out of range. You got this. That one is PCO2. It is below the normal range. Also, pH and PCO2 are going the opposite direction. Therefore, the answer is respiratory alkalosis. Case study number 2. Please pause the video and try quiz yourself. In this case, the baby patient has decreased pH and which is acidosis, and the PCO2 is normal range, HCO2 3 is decreased. So those are metabolic because those are equal direction, pH and HCO3. So the answer is metabolic acidosis. pH is decreased, which is acidosis, and then HCO3 also decreased, so is in equal direction. That means it's metabolic. So it's a metabolic acidosis. We are done for today. We have 2 assignments on D12. Please take post-test and complete the discussion by the deadline following the instruction on D12. If you have any questions, please don't hesitate to contact me. This is my email. Thank you for watching the video. I hope you have a wonderful day. Thank you.